everybody. This is Donna Nauman, and I'm a functional medicine nurse practitioner. Today, I have an awesome guest who is going to be talking about nutrition. Her name is Mickala Parsley, and she is a registered dietitian who specializes in oncology. So, wow, this is going to be a great hour of speaking about how we treat cancer patients with nutrition, how to do prevention, and what to do afterwards. So Mickala, tell us a little bit about what you do and how exciting this is. I think this is a turn of times that we are moving away from this dreary medicine where it's all about chemo and radiation. And now we're really looking at what could nutrition do for us?
Yes, so I am a registered dietitian. Like Donna said, I live in Indianapolis, Indiana. So if anyone is familiar with that area, I work for Franciscan Health and their cancer center. I work with both chemotherapy patients and radiation patients during treatment. And sometimes I do a little bit of education and talks for prevention or life after cancer survivorship, which is a great up and coming area. In the past, kind of patients were like, okay, I beat cancer, I'm done with treatment, and then they just kind of go back to living their life. But now we're kind of realizing that sometimes they need a little bit more TLC after treatment to kind of, their life is so different. They have a different perspective on life, what we can do to reduce risk of cancer recurrence. So yeah, I work with patients during treatment, before, after. And I love what I do. I truly feel like I make a very big difference, which is always very rewarding to have in your job. So
absolutely. So tell us a little bit about the cancer statistics and what that looks like as far as, many times we're not thinking about cancer statistics and nutrition together. So maybe just why should we be thinking about nutrition when we're thinking about the cancer statistics? So maybe just kind of talk to that a little bit.
So cancer is the second leading cause of death in the United States. I think pretty much anyone listening to this video today, this talk, I'm sure you know someone that has been affected by cancer. If it's not you yourself, it's so common and prevalent and increasing in numbers. And I think what a lot of people don't realize is that, for me, I have a lot of cancer incidents in my family. And I think a lot of people who have that same case, they think, oh, well, I'm doomed. I'm going to have cancer too, because my mom did, my dad did, my grandma did. But a lot of people don't realize that 40% of cancer cases could have been prevented through nutrition and lifestyle. So there is a bigger component of our environment, what we eat, how we live our life, versus just genetics. So it's a very important thing to keep in mind. So if you are at increased risk, what you can do now to prevent that from ever happening.
Yeah, I think in the functional medicine world, and don't quote me, but I think it's something like 10% of people that get cancer it's kind of coming down that genetic thing. And so I begin to think this is much bigger than just, oh, my mom had cancer and my dad had cancer, and then I'm going to get it. Well, even that mindset sometimes can be like that space where we begin to create a different reality. And I say that from this space of working with functional medicine patients where we're doing emotional assessments, we're doing heavy metal assessments, we're looking for mold and Lyme and all those things. But this whole component of nutrition and our nutrition has really changed over the years. Growth of food it's different, right? How we're growing food is different.
Yeah. So definitely the way our food is grown now is changing. Soil doesn't have as much nutrition as it used to back in the day, because we have so many people on this planet. We've got to feed everyone to sustain life. And so we're just farming. And a lot of times we can't keep up with the soil nutrition. Farmers add nitrogen to the soil. They try, with increasing technology to overcome that. But sometimes our food supply still isn't as nutritious as it used to be.
Yeah, so I think that really, and as that happens, the nutrient value of the food changes.
Yeah. And traditional American diet, you know, every single day there's a new fast food place closer and closer to your house. So
and yummier than the last one.
yeah, so not just, you know, the good foods that we do grow in the ground that we're eating, how that's changing, but really kind of our fast-paced lifestyles nowadays. You know, more people work in the home than they used to back in the day. So relying on quicker foods, swinging by drive-throughs, you know, all of those things are definitely going to be impacting our nutrition and our disease risk as well.
Yeah, I think that SAD diet, the standard American diet, also changes your taste buds so that when you are eating more healthy foods, it's kind of doesn't, it's different. Is that?
Yes, definitely. So if you're eating a high sugar diet, you're constantly going to be wanting those sugary foods. Whereas if you took a break, you kind of cut out the sodas, the candies, and you took a break from that for a long time, like a month or two, and then you try a soda, you may notice that it's way sweeter to you than it used to be, because definitely your brain, you get used to these high sugar, high salt as well. Sugar and salt, those are the two big ones for that. You get so used to it, you think you need it, you need more, but once you know, do eventually overcome those cravings and you cut back and you make changes in your diet, you will notice differences in taste too. So if you're so used to high sugar, high salt, things that are low sodium, low sugar may not, you know, be as good to you. Your brain may not, you know, light up as much when you're consuming.
It's like that baby spitting out their food that first time they get it, like, wow, what is that? I don't even like it.
Yeah.
So once a patient gets diagnosed with cancer, can you kind of walk us through what that looks like in your practice?
Yeah, so of course, you know, staging and diagnosing, all the traditional care of cancer treatment with the oncologist, the medical oncologist, and then the radiation oncologist. So your medical oncologist is your chemo doctor. Your radiation oncologist is your radiation doctor if you require radiation. And then there's surgical oncologists as well that would work to remove the tumors or any specialty surgeons needed. But what's happening, which is really exciting in the cancer space, is that clinics and managers and oncologists are starting to realize how important nutrition is. Both, you know, before cancer, which, you know, by the time they see the patient, they have cancer. So we're kind of a little too late for that. But during treatment, really they're noticing the power of nutrition and assistance from a dietitian during treatment. And then after treatment, to kind of help make lifestyle changes to prevent the risk of recurrence. So I typically work with patients when they're starting chemo or starting radiation, and we kind of work through, you know, at that point when they're first starting, their appetite's typically still pretty good. I kind of just go over what they like to eat, what they don't like to eat, you know, because I don't encourage patients to go home and revamp their entire diet and eat all these things that they don't even like, because you're not going to do that. So we kind of talk about what they like, their preferences, their eating habits, you know, when they eat, what times of the day. Some people only eat one meal a day, which is not a good idea during cancer treatment. We definitely will change that one. But kind of just work with them, give suggestions, go over. So I will calculate, you know, how much protein, how many calories are needed on a daily basis for them, because I think what a lot of people don't understand, and this is something I talk about the first time I meet with a patient, and they almost always are shocked, is so cancer itself, before you even know you have cancer, it is increasing our metabolism, you could say. It is requiring so much energy because it's trying to grow, right? It's building up, it's growing, it's increasing in size, and it's taking nutrition that we put in. So our calories, our protein, to build those cancerous cells and increase those tumor sizes. So your body is already increasing nutrient needs. So a lot of times patients will actually be losing weight.
That's kind of like a red flag, weight loss. And when patients come at patients come in the office.
Anything, but you're losing weight. That could be, a sign that something is going on. So cancer itself increases metabolism. We need more. But then you add chemo or radiation or both sometimes on top of that, and that increases our needs too. So you need way more calories and protein during cancer treatment than you did, pre-cancer. So
And isn't that really a time when they're like, almost like don't want to eat, their taste buds are changing, they're nauseated?
Yep. So a lot of times the side effects from treatment. So whether it's nausea or, and I know a lot of people don't like to talk about bowels, but this is a nutrition podcast. We're going to talk about bowel movements. Diarrhea is a huge side effect from certain chemos, or depending on where you're receiving radiation. There's so many factors. If you're having diarrhea all day or you're vomiting, you're not going to want to be eating. So we'll work together if you're having those symptoms, or if we'll see what treatments you're going to receive and what those side effects, because some chemos don't cause diarrhea. Some chemos typically don't cause a whole lot of nausea and vomiting, but other ones definitely do. And then certain chemos, especially the platinum agent chemos, they can change the way foods taste. So you could put something in your mouth that used to be your favorite food ever, and it's absolutely terrible. It's either like, sometimes it tastes like metal, like it will taste like metal, or salty foods are extremely salty, same with sugar. So we kind of work together through all those things so that we're keeping you well nourished during your treatment. Because if you're losing weight, you're more likely to have delays in treatment, which delays effectiveness of the treatment. You're also more likely to, have complications, end up in the hospital, and you definitely want to avoid all those things. So nutrition is a big part. And so they're starting to hire more nutrition professionals in the cancer center clinics to kind of be that crutch throughout treatment to help these patients, because oncologists don't have the time to be sitting there and going over all these things, and they're not as educated in the nutrition part as well, because they've got to know everything else. So
it's so true. So what foods do you usually recommend for patients? Because I know there's some theories about whether or not people should have sugar, that cancer eats a lot of sugar, so eating a lot of sugar feeds the cancer. What are your thoughts about that?
Yes, so it's typically women. I feel like women do, when they find out they have cancer, they do more research on their own. I don't know why, but men are just kind of out there, okay. But it's typically women coming to me and asking me this, or family members. So concerned family members that are at these appointments with their, they hear from a friend of a friend, or they read an article online, sugar feeds cancer, and then they're wanting to cut out all the sugar from the patient's diet. And this is kind of, it's definitely a controversial topic within the oncology space. And I know functional medicine practitioners as well, because a lot of times, how do we diagnose cancer? We're doing a PET scan, we're injecting glucose into your system and seeing where it lights up. That's usually the cancer spot that's lighting up.
Because they're eating up all the sugar that you put in the IV.
But there's been so many studies done that if you cut out sugar in the diet, they're not seeing the results, that the cancer doesn't grow as much. It's still growing. Cancer is relentless. Like I tell my patients, this is an evil being inside of you. And no matter what you do, if you cut out all the sugar, you have the most perfect diet during treatment. It just depends on the cancer. It can still continue to grow. Cancer tumors, cancer cells, they can create new blood vessels within your body to obtain nutrients from other parts of your body. It is truly relentless. So they haven't really seen that if you cut back on sugar in your diet, that you're going to starve your cancer or shrink your cancer. It's still going to grow. But that being said, if we have a high sugar diet, so we're drinking lots of sugary beverages, sodas, candies, all those things, our blood sugar is going to spike, and we will have more insulin trying to combat that. And a lot of cancer cells grow from insulin receptors. So the insulin attaches to the cancerous cell and it kind of fuels the cancer. So
I think I read I think I read somewhere, where did I put that at? Something like, I don't know, like the risk from that insulin, here it is, insulin doubles your risk factor for cancer too. Like, so that insulin really becomes a huge thing, what you're speaking towards. And a lot of people have those pre-diabetics that have insulin levels that are elevated that we're not treating from the medical profession because they're not necessarily a diabetic yet. I think it's a very important point. What you're bringing up is that it's a complicated mess. Like, it's not just the sugar, it's not just the insulin, it's not just the protein, it's not just the diet, it's emotion. Like it is like this big thing, but like really starting with these basic things, like what you're doing is start off with these basic things and coming to a nutritionist who actually knows what the body is doing with all these proteins, fats, oils, vegetables, and, you know, kind of combining that to make a plan going forward. So I'm sorry to interrupt because you were kind of on.
No, you're good. I know, I started talking, I get in a rant. So it's kind of just, you know, I tell patients, you know, I don't want you to go home, be scared to ever eat anything with sugar, because then if you go super to the extreme, that's cutting out fruits, which offer great nutrients to help fight cancer, prevent cancer. You know, they contain sugar. So it's talking about how to stabilize blood sugar. So eating a balanced meal, you know, something that has fiber and protein in it, along with the sugar, to help control the blood sugar spike and thus the insulin. And, you know, just trying to talk about healthy, balanced meals. But also I tell my patients, you know, a lot of times you're going to reach a point in treatment where your food choices are so limited. And ice cream, because ice cream is something that just works well for a lot of people during treatment. If that is the only thing you can eat, I don't want you to be scared of the sugar and not eat the ice cream, and then you're starving yourself because you're not eating anything because you're so afraid of the sugar.
So kind of going back to that, if they're starving themselves and they're losing weight, they're increasing their risk.
Because, well, increasing their risk of, you know, ultimately death. There's different numbers out there, but you know, up to 80% of cancer deaths are actually from malnutrition. So malnourished patients, not the
nobody knows that. Like, that is, could you just say that again? I think that's a very important point.
Yeah, so up to 80% of cancer patients, they're not passing away from the cancer, they're actually dying of malnutrition. So that's when, you know, most people associate, if you've ever watched movies, if you know someone who went through cancer, they start to lose weight during treatment, you know, they're becoming malnourished. You'll see their cheekbones more, their temples will be indented, they're losing muscle, they're losing fat. These are all signs that you are malnourished. So that's also a huge thing of during cancer treatment, we work so hard to prevent weight loss. I mean, we weigh you every single time you come in, not just to see, you know, how much chemo to give you, make sure we're not overdoing it, but to keep an eye on your weight loss and thus your muscle and fat wasting, because it is so important. And again, if you start to lose a lot and you're not doing well, your strength is down, your oncologist will likely say, okay, we need to delay this a week. You know, I can't keep giving you this treatment. You won't make it if we keep doing this to you. So they'll give you a week to kind of get your strength back, get your appetite back, eat a little bit more. And so, but the thing is, when we delay those treatments, the treatment isn't as effective. So we have these guidelines on certain chemos and how often to give it for a reason, because in studies, this is how they, you know, they cured the cancer through these strict protocols. Well, if we start making changes to that, it's likely going to reduce the effectiveness. And you're going through all this for a reason, right? You want to beat this cancer. So we want to keep you on track and keep you nourished so you can, you know, receive the treatments.
Right. Can you speak a little bit to like the phytonutrients? How is that important for people that have cancer?
Yeah, so I think, and this is, also for healthy individuals who want
Right.
to reduce the risk for cancer and also during treatment. I think a lot of people know, okay, fruits and vegetables, whole grains, beans, these things offer us good nutrition, right? Because we were taught this in school, we hear about it in commercials, the government puts out, back in the day, it was the food pyramid. Now it's more of like a my plate method. Most of us know that's healthy for us to get in these nutrients. And I think a lot of people know, okay, well, these give us vitamins, right? Well, there's also so many more chemically, so microscopic compounds within these plants, our beans, our fruits, our vegetables, whole grains, that people don't even know about. So a lot of these plants, they have to serve, they were a living thing once, right? Before we cut it and we're eating it on our plate. And it had to protect itself in nature. And so plants, their protective mechanism are some of these phytochemicals. It helps prevent disease for the plant. Well, we found through years of medical and scientific advancements that these compounds, these phytonutrients, phytochemicals, or what they're called, the plants use, that they have inside of them to prevent disease for them, helps prevent disease for us. So there's so many more things other than just vitamin and minerals in a plant. So some of the most common ones that some people have heard about is in tomato products. There's a phytonutrient called lycopene. And a lot of research has shown that lycopene is especially protective against prostate cancer, more than just prostate cancer, but that's a big one. And then, there's sulforaphane, which is my favorite. That's if I have a favorite, I'm a nutritionist, but that's in cruciferous vegetables. So your broccoli, your kale, your Brussels sprouts, cabbage, and that has been well studied to be protective against colorectal cancer. So there's so many different, many more.
that is kind of like a sulfur based. So what is the sulfur doing inside of the body that you get?
So usually these are regulating DNA replication, repair. So a lot of times how cancer starts, there's a little mishap in a DNA in a cell. And then that cell has this mishap and it starts overpopulating, right? And that's how the cells continue to replicate and replicate and replicate. And that's creating a tumor. So our body uses certain nutrients and phytochemicals and things like that to, help repair those DNA damages before they become an issue. Or, our immune system will notice, okay, that's a wonky cell. We're going to eat that and get rid of it. So these chemicals, these things, they help to just keep all of our our maintenance systems in check and, doing really well and, keeping up with everything that our environment and our diet and lifestyle throws at us.
Can you, I've heard a lot of people talk about the micronutrients. So like eating the broccoli before it becomes the broccoli, like buying.
Oh, the microgreens.
Microgreens,
Yeah. So
why are those better than broccoli?
Now, this is going to be my little disclaimer. If you are immune compromised, if you are an active, cancer patient undergoing treatment, we want to be really mindful of food safety. And a lot of times microgreens and sprouts have higher risk of E. coli. So for an active patient with a really weak immune system, low white blood cell count, I would say definitely don't go and start eating all of these, which a dietitian should talk to you about, or your doctor, about food safety. But a general healthy individual who wants to get the most out of what they're eating. So microgreens are like the baby plant. So the kale starts to grow. It's a little sprout, and farmers or you at home, I know there's a lot of really cool on the kitchen counter kits out there. You can cut those off, throw them in your smoothie, top it. It's real pretty garnish on like avocado toast, things like that. But what is so great about that is it's all the nutrition of a full grown vegetable in a little tiny bit. So it's kind of like really big bang for your buck. It's
Huh.
a lot of nutrition in a little tiny thing. So a lot of people like to use those. That's the
Yeah.
microgreens. You'll see
It's
that.
so weird because I've been in medicine for 35 years, and this year is the first time I've ever heard about that. And I think, wow, like that's a shame because
Yeah.
like that's such a beautiful thing to add to a healthy diet for prevention and for maintaining health. And so I think it's interesting that I've never heard of this. Like I've been doing this for a really long time. So I think that becomes where it's so important for us to be reaching out to nutrition people that do these kinds of things, that really have the knowledge, because like you have a knowledge base that a nurse doesn't have or a doctor doesn't have. And it's so intricate. Like the body is an integral thing of chemicals, and everything we eat is nothing until we eat it. And once we eat it, it becomes us. So we become that food that we eat. So that burger, those fries, those become us, those become our cells, those become who we are. And so like really trying to turn this so that people are aware, like how important, like some of the things that you're getting that help prevent cancer, like your vitamin C's and your vitamin D and all of those. Can you just speak a little bit to that?
Yeah. So, your vitamin D and vitamin C, both that you mentioned, play really key, important roles in our immune system, which I kind of mentioned a little bit earlier. Our immune system is constantly working in our body, and it's kind of like I picture them, because again, nutrition nerd, I picture them like little fighters in our body. And if they see something weird going on, they'll get rid of it. So that's kind of the same, like if there's a cell that could be a precancerous cell or is a cancerous cell, our body could potentially, through a very good immune system, get rid of that. And that's our protective ability that our body is blessed with. Certain nutrients help support our immune system. So like the vitamin C and vitamin D are both definitely important and help to build a stronger immune system.
And what foods would you get those from?
Yeah, so I love talking about vitamin C because I think everyone thinks of an orange.
Yeah.
That's
first picture that comes to your mind is the orange.
That's what Americans think of, I think, because orange juice is so common here.
Orange juice, yeah. And how much sugar is the orange juice?
And all the orange juice commercials you grew up with, like vitamin C, they always want to, boost what orange juice is good for, of course, smart marketing. But so many other things provide vitamin C. And my favorite to talk about is bell peppers. So orange and red bell peppers have about 3 times the amount of vitamin C as an orange. So there's so many other things that we can get vitamin C from. Our bell peppers, kiwi is a very strong source of vitamin C as well. Certain berries have a good amount of vitamin C as well. Our greens contain some vitamin C. So there's so many other sources of vitamin C definitely that you can get in. And to talk about, since we already just briefly mentioned the orange juice, we definitely always want to try and get our fruits and vegetables from the whole form itself versus the juiced version. Because what happens when we juice something is we're removing all the fibrous structure and we're just keeping the sugar and water. And there's nutrients in there. I mean, juice contains vitamin C, other phytochemicals, different good things in there. But the fiber that we're removing helps to control that blood sugar spike that we talked about earlier. So, and Americans aren't getting enough fiber. So
I think statistically we're eating between 5 and 15. And I think back in the 60s, it was something like 55 to 100 grams of fiber a day. And I super think that's important, especially for colon cancer prevention too, is that whole, I kind of like, you're a nerd on that nutrition and I'm a nerd like with these weird things, but I think of the scrubby bubbles and you spray them and then they go in the colon.
Fiber goes through and scrubs.
Yeah, I think that's cool.
Yeah. So like you said, I've definitely read a lot of most Americans are getting 10 to 15 grams a day. What we do want to be aiming towards is more of the 30 grams a day. I think technically it's 25 grams for women, 38 for men. But, making sure we're getting higher numbers of fiber, definitely, that's a huge one that a lot of research and evidence to suggest that if you're eating a high fiber diet, you're going to be preventing a lot of different cancers, especially the colorectal, because it's going through there and keeping your colon clean.
Yeah, I mean, there's like just three, like it helps with our weight, it helps with the insulin levels, it helps with the blood sugars, and it helps prevent cancer. So it's just a one small little thing. And usually like selenium, I add that to my morning smoothie just to kind of like give it a little extra bulk. But yeah, I think fiber is definitely important. So you have cancer and you're kind of losing your hair and your body is changing. What do you then recommend for those patients?
I mean, the biggest thing is protein. I mean, aside from keeping your body weight as stable as you can throughout treatment and preventing weight loss, the number one nutrient out of everything. I mean, obviously we want to get our fruits and vegetables when we can, but during treatment is protein. So, your eggs, your peanut butter, if you can handle dairy products, your lean meats, so your chicken, your turkey. Now we do recommend during treatment and definitely before and after cancer to limit red meat. That is something that there is strong evidence, red and processed meat. So your beef, your pork, and your lamb, limiting that to 12 to 18 ounces a week, which if you think about it, that's still going to give you a couple hamburgers or, whatever you're using the ground beef or pork in some spaghetti or something. It's going to give you a couple servings of that. So you don't have to cut it out completely if you like those things. But then our hot dogs, our lunch meats, we truly do want to cut those out of our diet as much as humanly possible. The nitrites in those processed meats are linked to cancer. They don't know the direct mechanism of how it's causing cancer quite yet, but they've deemed that is likely what is the link, especially to colorectal. So trying to cut that out as much as possible. But aside from those, trying to get in protein throughout treatment, because what our body does to build new healthy cells, our new hair cells that we lose. A lot of patients will get mouth sores during treatment, the platinum-based chemotherapies, and just depending on what's going on. Our body's going to be wanting to, slough off those bad cells and rebuild new healthy tissue in our mouth. Everywhere in our body, our cells are just dying off because that's what the chemo and radiation are designed to do.
Right.
But a lot of times healthy cells get killed in the process, unfortunately. So protein needs are so elevated during treatment. So getting in as much as you can. A lot of times we'll talk about, protein shakes, because that's a little bit easier for patients during treatment if they don't feel like eating a big meal, because their appetite isn't as good. So protein is a huge, huge thing we talk about a lot.
So, and what do you recommend for people that like their taste buds are all metal and they don't want to eat and they're starting to lose weight?
Yeah, so if they're having certain side effects like that, so the metallic taste, we want to cut out. Big thing that is a huge game changer, quit eating with silverware, like your traditional silverware. You're actually tasting the silverware. It's a weird phenomenon that happens during chemo, but that's likely what you're tasting. So switch to plastic silverware or use chopsticks or whatever you want to use. Bamboo if you don't want to use plastic and hurt the environment. But getting away from that silverware, avoiding foods from cans. So a lot of times cancer patients, they don't want to cook. So they're using like canned soups, they're working with
canned soups are good for you and you're sick.
Yeah, they're
another ploy on the marketing, huh?
Yeah. They're trying to get that protein in, so they're doing the canned tuna, canned chicken. But even after it's removed from the metal can, it can still taste metallic to the patient. So trying to, eat out of plastic containers, things like that, frozen vegetables versus canned vegetables, trying to stick with non-metal products. That's a huge game changer for the metallic taste. Now, if
so interesting.
yeah, a lot of times patients will lose taste, like all food just tastes like blah, like cardboard. I'll get that a lot. And that's really playing up citrus flavors. So squeezing lemon juice or lime juice or orange, juice. True Citrus is a great company I use a lot and recommend in the cancer center. It's basically just dehydrated lemon juice or orange juice, lime juice, and they're little packets, and they can sprinkle that on their food. For some reason, citrus is easier to pick up at that time. So marinating meats in citrus marinades can help. And then playing up herbs and spices, which also have good health benefits, because we're getting in those phytochemicals that we talked about earlier from the plant, the herb.
Right.
But it's also going to add more flavor to the food. So just try to make it really flavorful to where at some point you're going to end up tasting it. You just have a higher threshold, and we got to figure out what we can do to give it some kind of flavor, because food is meant to taste good, so we eat it. So when it doesn't, you don't want to eat, and then you're losing weight and going down.
Kind of back to that, food is medicine. It is So you mentioned herbs or spices, and I know like oregano is a really powerful antibiotic, and I know some of them are also antivirals and help kind of protect the body. Is there some like a go-to for you for those?
I'll get so as far as herbs, really, I mean, there's so much research on so many different ones. Parsley is a big one that's been well studied, to have anti-cancer compounds or phytochemicals in there, which shameless plug, my last name's Parsley, so love that one, of course.
Love parsley.
Yes. But really any herb you're adding is going to give you health benefits. And then turmeric.
I love turmeric. Yeah.
So looking at, so that was herbs. Turmeric is a spice. It's a root that is turned into a spice. And
does ginger fall in that too?
Ginger and turmeric, yes. Both. Those are the two main spices that have definitely been well, studied in labs to have some definite good anti-cancer benefits. This is the another disclaimer I'll throw in there though. A lot of patients find out about the turmeric doing their own research or talking to someone, a health professional who knows about the powers of turmeric, and they'll buy turmeric pills online at the store. Turmeric can actually interact with some of your chemotherapy drugs, a lot of supplements. So that's a big thing. We could talk about that forever, which we're not going to get into that, but always run by any supplements that you are taking with your health professional. A dietitian, number one, if your cancer center has a dietitian, but also the oncologist, because there are so many drug interactions with those supplements because they're at such a high level. You can eat turmeric in your diet because that's only in small amounts. But supplements are extreme amounts of certain nutrients, and it can definitely interact with your drugs. And you're going through all this for a reason. You want that drug to work, so don't be taking something that's going to block that from happening. Some supplements can also increase side effects of the drug. So, heighten the nausea, heighten the diarrhea. So we don't want to be doing that either. So always run that by a professional. But cooking with turmeric, I like to add it to different soups and stews. Anytime you're cooking with turmeric, add a little pinch of black pepper.
Yeah.
Increases the absorption by 10,000% or whatever. So always, and if you ever see a supplement in the store, you'll see that they most of the time they add black pepper to that, and that's why.
Is there a difference between the cayenne pepper and the black pepper? Because I always heard it was a cayenne pepper, but it's a black pepper.
For the turmeric, it's black pepper.
Good to know.
Yeah, and the ginger is great. A lot of times patients, I think most everyone knows this, have nausea during chemo. Ginger tea, ginger, you can find little ginger candies that you can suck on. A lot of times ginger will really help settle the stomach, prevent nausea. There's another company that I work with, they're called tummy drops. And it was created by a GI doctor, and they're little hard candies my patients can suck on. I luckily get the hookup. I give them out for free at my clinic because they are a little bit pricier, but you can get them on Amazon. And they are really great. My patients swear by them. So they can help with, indigestion. If they're having a lot of cramping from the diarrhea side effects, sometimes it helps. And then, of course, the nausea, they can suck on those, and it's because they have ginger extract in there.
Nice.
Yeah.
So you have lots of little tricks and things.
I know. I love it. I've got all the tricks. So the patients throw a lot of things at me, and I got to come up with what we can do. I mean, it's a tough time a lot of times during treatment, but there's always something we can try out to see if it helps.
Well, it sounds like you have like a whole toolbox of things. And I think one of the reasons that I think this is so important to get out in video and into the world is that I think this is a place of hope. And what you're bringing for patients is hope. The hope that when they get through the treatment, and they will get through the treatment, that they're healthier, they're making better food choices, they're learning about the body and the things that the body needs, but also like just feeding it the nutrients that it needs to get through the cancer too, because as you said, the weight loss is such a big risk factor for dying. And I don't think people think about that a lot. I mean, I know I've heard a lot of people say they get on that ketone diet and they start doing intermittent fasting and they start doing all those things. Well, all of those things make you lose weight. And it sounds like maybe that could be a risk factor instead of something that's beneficial.
Yeah. And I want to point out that we haven't brought this up yet, but this goes for anyone. So if you started cancer treatment and you were 400 pounds or you are morbidly obese, you're overweight, a lot of patients, especially where I work in Indiana, we have a higher percentage of an obese population. A lot of patients come to me and they think this is a diet, like, oh, I'm going to lose weight during treatment. This is going to be great. And they like the weight loss. Now, this is no matter if you're underweight, a healthy weight, or overweight. If you lose weight during treatment, it's going to negatively affect your outcomes. So that's a big thing that we definitely have to work through. Sometimes patients still don't listen and they don't understand. They're just not comprehending how dangerous it is. And they like to see that scale go down and down. But what I tell them to try and trick them into actually listening to me for once is that, and it's not tricking because it's true, but I will ask them, okay, you've lost 10 pounds in a week. Do you feel weaker? Like when you open a jar or you're doing your yard work, do you feel weaker? And they'll say, 10 times out of 10, say yes. During treatment, you are losing muscle. You're not losing the fat that we eventually do want to lose, right? We want to be a healthy body weight to reduce the risk of cancer. But we're losing the muscle because muscle is stored protein and they're clearly not eating enough. We talked about how important protein is during treatment. So our body is going to break down our muscles to obtain protein to utilize. So we're losing our muscles. We're not losing that fat that we want to lose eventually. So that's a big part. No matter how large you are when you start treatment, we want to avoid that weight loss.
That's so interesting.
Strong.
So interesting. I mean, I think what we're speaking to today is there's just a lot of myths and a lot of, the media really pushes a lot of things. And I think it's important. I think the couple of things that I've really taken, no weight loss, really watching your protein intake, really touching base with a nutritionist, really coming up with a plan. So maybe just to kind of on an end note, people have made it through the cancer, then what?
Yep. So, and this is kind of a new emerging topic in oncology world. Our hospital has a really great program for cancer survivors that, unfortunately, we don't have a ton of people signing up for, because I think a lot of people are like, okay, I'm done. Like, I don't want to ever think about this again.
There's so much fear. Yeah.
Yes, but there's a great survivorship program that we have created, and I know a lot of other hospital systems have something along the lines as well, where we will touch on nutrition, physical activity. So a dietitian will talk to them. Right now, of course, in the COVID world, it's virtual. So 1 week a dietitian will come on. I don't know if it's a physical therapist or an exercise or a personal trainer or something, but someone will come on and talk about exercise, and they'll go through a workout, of course, an easy, light workout, talking about stress, emotional. So a counselor will get on, because that you just went through so much. And I don't think, unless you and me go through cancer ourselves, we will ever fully comprehend what it's like. But you went through so much stress, emotion, and we need to process
trauma.
that.
It's just trauma.
If we don't address that, that can definitely, I think more and more information is coming out. And I know you work with patients on that, but that can negatively affect your health in the future. So kind of working, try and see things that you can do afterwards to address all pillars of health, physical, emotional, mental health.
Right.
But I do want to talk about, before definitely we end this, that there is an amazing organization. If I could refer you anywhere as a listener to this video, the American Institute for Cancer Research. Their website is aicr.com. They have so much amazing, foods that fight cancer, different recipes. They have their own plate method, so a way you can be eating to reduce risk of cancer, and you want to do that before and after cancer. So if you want to reduce your risk, or when you're done with treatment, how you want to eat to prevent from ever having to go through this again. And then they have 10 main tips to prevent or reduce your risk of cancer. And they teamed up with the World Cancer Fund, or World Cancer Research Fund, whatever their exact name is, to come up with these. And I just want to go through these real quick, summarize them. Number 1 is to be a healthy weight. So kind of touched on this a little bit, but having a healthy body weight is going to do so many things to help reduce your risk for cancer. So just 2 main things. Typically, if we're at a higher body mass, we have some insulin resistance, and we have that insulin floating around just extra in our body. And we already talked about that earlier, how that can it's like a growth hormone for cancer. And then especially for women that are overweight, like almost all of my breast cancer patients, they typically are overweight, and that's because higher body fat equals more estrogen in our body. So there's so many other reasons, but being a healthy body weight is a huge thing to work on.
And there's a lot of hormones too for men that are like they're more estrogen dominant when they're overweight, so they have less testosterone. So that's another, the males don't get off easy with the hormones either.
Yes, and so men who are overweight are at increased risk for prostate cancer as well, because that's usually hormone sensitive. The second one is to be physically active. So when we are physically active, our muscles are working, we're going to be more of a healthy body weight, but that's also going to reduce that insulin floating around in our body. And so we definitely want to try and stay physically active.
That physically active, I'm just going to plug for that too, because that's one of my favorite things. It also is a detox. So every time you exercise, you are detoxing. That sweat is made up of chemicals and things that our body is trying to get rid of. And sometimes those are the bad things we need to be getting rid of that we don't get rid of in other ways.
Yeah. So even if you are physically unable to go through a really intense, high intensity workout, just walking, or if you have a gym membership or some ability to get to a sauna, there's a lot of good research coming out
Infrared.
about the benefits of sauna in recent years. So even if you can't physically run or do burpees or do these things to where you're sweating a lot, just sitting in a sauna for 10, 20 minutes can get that sweat going, and it's good for the cardiovascular system and things like that. The third tip that is from the American Institute of Cancer Research is to, of course, kind of talked about this, but a diet rich in fruits, vegetables, whole grains, and beans. Beans are really great, little powerful nutrition, beans and lentils, all the pulses. And then, of course, the next one is limiting our processed foods and processed meats and our sugary beverages. Well, that's a separate one, but we definitely want to, work on having a better diet and cutting out some of those things that don't provide us with any health benefit. Every time you eat, you want to be trying to get in something that's going to benefit you in some way.
I think on that one, I would like to ask people, if you are eating fast food and that's kind of your regular daily things, is trying to find one meal a day, one meal a week, however you can do it. Just start with one and just try to process that. I think this, the ability to get people to switch over to an awesome diet when we are eating this standard American diet is so difficult. But if you could just do one meal a day or one meal a week, I think it would go a long way.
Steps, definitely.
Go a long way to kind of tell your brain, like, this is what you need. Just diet alone. In my practice, I see people with rheumatoid arthritis. I see people with fibromyalgia. We change their diets, their pain goes away. And it's not anything different than with cancer and doing cancer prevention. So big plug for that.
Big, yes.
Hope you don't mind.
No.
I love this stuff too. I'm so nerdy about it. It's like, oh my God, I got something to say.
I know, I had to write these down, so I'm reading off the list because it's a lot to remember all the things. But so we just talked about limiting the processed foods, the fast foods. But the next tip they have, and we touched on this earlier, is reducing the red meats and the processed meats, your hot dogs, your lunch meats, your bacon. You want to avoid the processed meats as much as possible. I mean, cut that out if you can, 100%, great. But the red meat, it is more moderation. You can certainly have some, but trying to definitely stay under the 18 ounces a week. That is kind of what this organization has come out with as a good amount that, you could be okay with that amount.
Yeah. And I think just speaking to that too, until I became a nurse practitioner, had no idea what portion sizes were looking like for patients at home. And it's very interesting to me because I eat like a half a piece of chicken. That's what I have for dinner. And I know that there are people that are eating 2 or 3 breasts and, like just being more conscientious about what is a serving size, because you can eat chicken, but a half a breast versus 3 breasts is a very different, It's
a good rule of thumb for a piece of meat is a deck of cards, both the width and the length or whatever. That's 4 ounces of meat typically. That's
yes, yeah. So I just wanted to kind of point that out too, because
very important to know what, because I say 12 to 18 ounces, and you're probably like, well, what is that? I mean, I know when you go to a restaurant, you order how many.
And at the restaurant, my God, that plate's enough for several people.
Yeah, so if you're sticking to 12 ounces, that would be 3 times a week of a deck of cards of red meat.
Yeah, so, thank you. That was a good tip.
Yeah, visuals are always good. Yeah. Reducing sugary beverages. So this, not just the soda. I think everyone knows sodas or pop. I live in Indiana now. I've had to learn to say pop, which is crazy to me. But the soda, the pop, trying to cut that out as much as possible. But there's so many other things that sugar is in that we drink that people don't even really pay attention to. So, if you drink a lot of sports drinks, a lot of times the sugar adds up in that.
Mhm.
There's sugar in that. Your juices, like we talked about earlier, we don't want to be drinking juice all day long. That's a rich source of calories. It's definitely quite a bit of sugar. Now, there are health benefits to it, but we still want to keep that in moderation and do the whole
So
form.
if you're looking at the bottle and you have people look at the carbohydrate count per serving, because I think that's also important, because a half a cup is very different than we typically are, draining a couple cups. So you're looking at what the serving is. So if it's a half a cup, it's a half a cup. And then if you're looking at the carb count, what would your recommendation be for like stay under, or what for sugary content?
I really don't have a number for that. I mean, what I like to look at the best is under carbs. There's going to be total sugars. And then now with our new nutrition label that went into effect of July of this year, all food companies had to have a new one. You'll start to see an added sugar line.
Mhm.
So we definitely want to avoid added sugars.
Okay.
But some juices don't have any added sugar, like if it's truly just fruit. But really just trying to just watch how much we're doing. I'm sorry, I don't have a good like
Yeah,
carbohydrate.
I think I heard something like 5 apples is like a half a cup or a cup of juice.
I mean, it takes a lot. If you've ever, I know a lot of people don't do this at home, but
Yeah.
my father-in-law bought a juicer, and if he would probably never listen to this video, but if he did, he'd call me out. But he bought a juicer because a lot of people do go on like juicing diets, or a lot of times that's sold to cancer patients, but we don't even get into that. But a lot of people think that they can juice a lot, and it's definitely going to be a good diet for them. But he never ended up using the juicer. And so I now have it because sometimes it is fun to make like a green juice. Trying to get in more vegetable juices versus just all fruit will cut
You
down
hear a
on the
lot
sugar.
about celery juice and is it cranberry juice? I don't know. There's another one, but they're so
Lots of
sugary.
juices. So that celery juice, yeah, just stay away from that.
Stay
If
away
you
from
want to
celery.
drink it, it's disgusting, but if you want to drink it and add it into your diet, certainly add it to your diet. But don't take away food and only drink celery juice. There's the literature isn't there to support all the claims that people put out about the celery juice. But
Yep, there you go. It's just advertising. It's a good thing that you know these things.
I know. And then of course, chocolate milks, things like that. Lots of sugar in those as well. So many other drinks other than just the sodas that you want to pay attention to. The next tip from the American Institute of Cancer Research on their 10 tips list is to limit and really, in a perfect world, avoid alcohol. Alcohol is a carcinogen. I mean, it is straight up a carcinogen. It has been proven, all the literature is there. It causes, there's a very strong correlation. So a lot of alcoholics will have really cancers anywhere from the GI tract, because the alcohol is traveling through the mouth, down your esophagus, into your stomach. And they're certainly at risk for lots of cancers along that route. So, trying to cut back on the drinking, definitely. That's a big one. That's, as a young 20-year-old that likes to go out and socialize, this is definitely something that, I'll even admit that I struggle with, and I'm always trying to work on that myself, because it is a strong correlation between cancer and alcohol consumption. Supplements. So we kind of talked a little bit about supplements throughout this discussion, a little bit here and there. So the pills, like the turmeric we talked about, super high doses of certain antioxidant vitamins, so vitamin C, vitamin E. The American Institute of Cancer Research has definitely put out a statement you don't want to be taking all of these in high doses for cancer prevention, because they've actually seen quite a handful of studies that patients who take mega doses of some of these nutrients end up having higher risks of certain cancers. So there's a couple different famous studies out there, like the carrot study. There's one that looks at high doses of vitamin E. So people that take vitamin E orally were at greater risk for prostate cancer. So there's a lot of different things out there. So they definitely want to make people aware that we want to get it from food first. Always want to get these nutrients from food, because not only are you getting that nutrient from the food, but you're getting so many other things from the food as well, like the fiber we talked about reduces cold. Yeah. So if you eat a whole orange, because we talked about vitamin C and orange, everyone knows that. You're going to get the vitamin C, you're going to get the fiber, but you're also going to get so many other nutrients in there. Like we talked about those phytochemicals that orange needed to protect itself from disease. We're going to be getting that. So, definitely avoiding lots of supplements for cancer prevention. Breastfeeding. So, of course, this can be a sensitive topic for a lot of women if breastfeeding was not something that they were able to do. But if you can breastfeed after you give birth, that has been shown to reduce your risk of breast cancer. And I believe ovarian too. But definitely the breast cancer. So trying to breastfeed. And then it's also, as long as you breastfeed, reduces your risk more. So if you can breastfeed longer, or if you've had multiple kids and you breastfed each kid, you are reducing your risk further. So
interesting. There's also, do you know, like if your oncologists have your breast cancer patients do breast manipulation a couple times a week, where you're just kind of like almost like a massage?
Oh, to like try and like move the lymph. I actually never heard if they're doing that. But
I just read an article. I just read an article about it. I don't know, maybe last week or something. I kind of do like the meridian and the chakras and stuff. And so like the meridian kind of runs the same as our lymphatic system. And I'm thinking like more for prevention, but I did also read in one of those books that they're having their patients do that, the nipple stimulation too. So I don't know, that'd be something for somebody to look up, but it is
because what the breastfeeding is doing is it's encouraging, movements of fluid. It's encouraging cells, for apoptosis to kill off cells and rebuild new healthy ones. So it's just a lot of stimulation to the breast. And also it reduces your exposure to estrogen throughout your lifetime. So that's another key factor to those estrogen sensitive cancers. So breastfeeding if you can. And then the last tip is to follow all of these again after cancer. So you want to follow these tips if you can to prevent your risk for cancer. During treatment, we're really just working on keeping you nourished, doing what we can, preventing weight loss, getting in that protein. Then after treatment, going back to some of these 10 tips and trying to, make changes, lose weight if needed then, not during, and work to prevent your risk of recurrence.
Very nice. Very nice. I think for the community of people that are listening today, I really want people to know, like, there are so many resources. Since we're here, I'm just going to share, like I have a couple books. This is a cancer-free. This is a really awesome read about if you're looking for information that has some validity to it or some studies to it. And then this is by a doctor, and he's also a nutritionist. So he's an MD and a nutritionist. And again, it's just finding these places to have hope. And then on, like, these are more of a national level, like reading books and getting educated, but more on a local level is speaking to people like Mickala, speaking to your oncologist, speaking to a counselor. I think every person with cancer should have a counselor. I mean, how did all this happen, and what is stuck inside of you that you need to be working through? And the whole cancer diagnosis is so scary to begin with. And if nobody recommends those things, then ask for a nutritionist like Mickala to come on board. Ask what should I be doing to keep my weight steady? What should I be doing when I can't eat or I don't want to drink water? Because those are real things. And cancer is beatable. People beat cancer all the time. It does become a chronic disease, just like diabetes and hypertension, but we have to remain hopeful and remain in this space. Like, there are things that you can do. And I think, Mickala, you did an awesome job today, like really sharing with people, like, what is living? Like, living is about first doing prevention, but then if something happens, then you start doing interventions and all the things that you're doing with your patients and loving on them and being with them. And I would go so far to say that every cancer patient that gets a nutritionist gets one more piece of love, one more piece of somebody that's really there to help them. And I'm not sure we get all of that from our oncologists. Like, they do love us, but they're more interested.
You don't have the time. I have much more time to sit with the patients. And I do want to know, all these services are free. So a dietitian in the clinic is free to you. Like, some people will ask, do I have to pay more money? Because there's a lot of financial concerns with cancer treatment. It becomes expensive. That's free. The counseling is always free as well. There's so many services that someone can put you in connection with. If you live in a really small town, your cancer center, unfortunately, may not have all of these things. I was hired on a year ago at my small town clinic. There was no dietitian before. So they would have to be referred to our sister campus and have a phone consult. So, always try and be your own patient advocate, because there is always someone that can put you into contact with someone that you need.
And I think that's a great place to end. Be your own advocate and use food as medicine. Mickala, thank you for coming today. This has been an eye-opener of learning all of these different strategies and understanding that there are strategies that we can do.
Thank you for having me.
Yeah, well, I'm sure I know that you're doing awesome work, and I know you're helping a lot of people, and that you took the time out today to be with the community, to help the community. And I hope that everybody that watches this would pass it to a friend, because somebody out there needs this. And that is like really what the journey is about. So thank you again.
Yeah.